Hey everybody, it's Eric Field here with New Patient Group. Welcome into this week's 5 Fantastic Minutes. So glad you're joining us here. Got a good one for you today, and this is going to be specifically relevant to that exam room process. So treatment coordinators, I hope you'll take a couple of easy notes on this very simple idea. And it's something that's important because I don't see it happen often in most practices. And the idea is simply just spending time getting to know that patient. I'm especially talking about your younger patients, your teenage patients, is investing time and energy of just getting to know them. What are they about? What do they enjoy doing, etc. And the reason I say this is because as I go to a lot of different practices and I kind of see what normal looks like, what typically takes place is they immediately start going into the new patient's paperwork that's been completed, maybe asking some questions about that. They immediately start talking about what their treatment goals are, what are their desires for the outcome of their treatment. It might be something where they start walking right into getting some records captured, etc. And what I want you to appreciate is it is time well spent. It's an investment of time, but there's a tremendous return on that time to just simply talk to that 12-year-old, that 14-year-old, get into their world, right? And I know mom or dad are sitting over there next to you, and I know a lot of times our attention may migrate over to mom and dad, but I want to encourage you to not do that. You can include mom and dad in the discussion, but keep your attention focused on that 13-year-old little girl. All right. And ask her about school activities. Ask her about sports that maybe she participates in. Ask her about other extracurricular activities. Ask her about things that she enjoys doing outside of the school environment. And don't make it an interview, rather make it a conversation. So as she replies, as he replies and gives you some answers, dig deeper into that answer. Go deeper into, second and third layers of where that conversation might take you. And there's a couple of really powerful things that happen when you're doing this, all right? Number one, obviously you're building some trust. You're helping that child who might be a little nervous. They might be afraid of what they're about to experience. They might be perceiving you as much like they would a dentist, which certainly, teenagers and all that don't love the idea of going to a dental practice. Who does really, right? And so they might have a little bit of some nerves. So you're unnerving them. You're helping them to feel comfortable. You're helping them feel confident. You're coming off as a friend and an advocate to help them. That's one really important thing. Secondly, is you're impressing mom or dad. They love to see people engaging with their child. Maybe nobody's spent time really trying to talk to their child on a personal level, right? Nobody's really dug into what their kid's all about and what they enjoy doing. And they love to see someone who's taking a few minutes to take a genuine and personal interest in what their child's all about. So that's giving you some brownie points, which is going to add up in just a moment when you're asking for their conversion and their same-day conversion. And the other thing that's really big about this, virtually every client that we work with in the orthodontic space wants to promote Invisalign clear aligners or clear aligners in general. And so as you're engaging in having this conversation with this young patient, you're learning things about their lifestyle that are going to help to give you the ability to prescribe treatment towards their lifestyle. So rather than just saying we're going to do braces or we're going to do Invisalign or what do you want to do, is we're able to give more guidance and direction prescribing into their lifestyle. We'll talk about that one in more detail in a future 5 Fantastic Minutes, but it's definitely a benefit when you can learn about this child, that they play baseball, that they love dance, that they're in the school's one-act play. Those are things that are going to help us down the road as we start to coordinate their treatment towards their lifestyle. So easy idea. Just take time. It takes 90 seconds, takes 2 minutes. Just get into their space, learn a little bit about them, impress them, build trust, and ultimately learn some things that are going to help you down the road as well. Thanks everybody for listening. Don't forget to jump in there and look at the most recent New Patient Group podcasts, as well as subscribe and like this video right now on our YouTube channel. Thanks everybody.